Some of my top women's healthcare docs, I'm not going to say who because I don't want to embarrass anybody, but some of my top women's healthcare docs have said to me, menopause, it's not a disease. It's nothing, it's not something to be cured. You don't have to go on drugs to solve menopause. And there was like a sort of a lefty woman's bias of like, these men who are trying to get us to tap into some fountain of youth so they can enjoy sex with us more don't understand that this is like a normal progression of and it's, to me, I was like, wow, that's so crazy. You don't have to be looking for a fountain of youth to go on HRT. You can be looking for all these other benefits, but I have heard more than one doctor talk about it like they resent it.
Yeah, look, this issue is polarized in medicine, just like society is polarized around politics, and there's a lot of misunderstanding. Hormone replacement for perimenopausal women is exactly what it says. You're replacing your body's natural hormone production. And there are actually hormone replacement forms that are similar to the exact molecule that your body produces. And there was an observation at the Mayo Clinic in the 1950s that when a woman had their ovaries removed in their 20s, that is, young women had their ovaries removed, say, for cancer or some other reason, they were developing early heart disease. And that data showed, including one woman who had a fatal heart attack at age 28. Well, what does that tell you? It suggests the profound cardioprotective effect of a woman's estrogen level. And so when you remove the ovaries, and basically this happens functionally in menopause, the body's natural production of estrogen goes way down. We're talking about continuing the body's natural levels. And progesterone is recommended to add to estrogen if a woman has a uterus. A third of adult women do not have a uterus. It's been taken out for some reason. But if a woman has a uterus, it's recommended you take both estrogen and progesterone by doctors out there. Again, the doctors at the FDA expert panel, I thought, did an amazing job. The stuff everybody should know.
Mm-hmm. Yeah, because the progesterone protects you from uterine cancer. So you have to take that too, in addition to the estrogen. And the other thing is, by the way, I've talked about this with women's health doctors who have come on this show. Sometimes when you get older as a female, your sex drive can start to go down. And HRT can help with that too. Getting your levels back up to just sort of normal, for lack of a better term, is helpful in that regard. So it can be, can lead to other good things, marital health and all that. I do want to play, speaking of the doctors who are at the panel, Dr. Joanne V. Pinkerton, she was there, and she's as frustrated as you are about the fact that if you get hormone replacement therapy, there's still what's called a black box warning on it right now, which will scare the bejesus out of most people. Here she is lamenting that, Sat One.
I am begging the FDA, and all of us are begging, please remove the box label. Put a warning: if you bleed, you need to be evaluated for that rare risk of endometrial cancer. If you've had an estrogen-sensitive cancer, please include your oncologist, and please stop harming women.
Because you see that black box label on anything you're going to take, and you're like, it's a no.
Yeah, look, when I came to the FDA as the commissioner just over 100 days ago, and we looked under the hood, I was shocked at some of the stuff we learned. There was still a black box warning on vaginal estrogen cream and systemic estrogen. We learned that the FDA had just approved Americans to have their cells gene edited in China, literally cancer patients having their cells shipped to China where they would manipulate the gene of those cells and then ship them back to be infused back into Americans. We put the halt on that. Illegal Chinese vaping. I mean, there's all kinds of stuff we learned about. But this is something that I had heard about from many women, because the issues in women's health have long been ignored. Some say it's been a male-dominated medical establishment in a prior generation that resulted in this. And some say we've never really recognized what perimenopause is in the medical profession. I was kind of taught, well, some women go through it, and some women all women go through it, but some have symptoms, and the symptoms are usually mild. Well, that's not true. 80% of women go through it, and it can last 5 to 8 years or longer. And for many women, those symptoms are severe. Things like dryness. Now, dryness can have a lot of implications. Vaginal dryness can make sex much more difficult. There have been divorces stemming from this issue in one's nasal mucosal cavities, eye dryness, skin dryness, hair thinning. So, things like that were ignored. And instead, when a woman came in with symptoms of perimenopause, be it the mood swings, weight gain, night sweats, or the dryness, or whatever the symptoms were, a woman was more likely to be prescribed an antidepressant than hormone replacement therapy.
So typical. That makes perfect sense. Now, wait, and perimenopause is the period right before actual menopause, right? Like actual menopause is when you haven't had a period for a year, and perimenopause is a number of years like leading up to that, where you're not quite, on the schedule you used to be, but you can feel yourself crossing over. The change is coming upon you. So that's but it's all time where you could be getting the HRT. And you're saying you need to be doing it within the first 10 years of the onset of perimenopause?
Yeah, for example, the cardiovascular benefits flip if you start it too late. If you go roughly, and this is just sort of a general rule that some doctors use, if you go 10 years without it, or you start it after age 60 as a rule of thumb, some doctors use. Again, I'm not telling people what to do, but this is what some doctors say. Then you go too long without it, the blood vessels sort of narrow and harden, and then the cardiac benefit flips into a risk. And because, of course, hormone therapy, as with oral contraception, has an ever so slight risk of blood clots. And so that creates a risk of harm. So that benefit turns to a potential risk of harm if you start it too late. That's why people who are, more than 10 years after the onset of menopause, there are really no options that many doctors will say there's no options at that point. And of course, they're angry, and they have a right to be angry. They've been misled by a medical establishment.
Do you stay on HRT forever? Like if you do start it early?
I'm learning in this job. I have to be careful what I say here as FDA commissioner, but many doctors do keep their patients on it for life.
Since President Trump was sworn in, his administration has made enormous progress at a breakneck pace. But don't forget, while they're moving mountains for the good of the nation, you've got your own personal savings to worry about. And one of the best ways to look after your savings is through diversification, particularly with gold, like from Birch Gold Group. In the past 12 months, the value of gold has increased by 40%. OMG. Central banks continue to bolster demand for gold by buying in record quantities. Global instability and tension is high, and Birch Gold makes owning physical gold extremely easy. Easily convert an existing IRA or 401k into a tax-sheltered IRA in physical gold, or buy some to store in your home safe. Just text MK to the number 989898, and Birch Gold will send you a free info kit on gold. There's no obligation, just useful information. With an A+ rating from the Better Business Bureau and tens of thousands of happy customers, take control of your savings today. Text MK to the number 989898. Thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.